Hello and welcome to GP Notebook TV. My name is Jim McMorran. I'm a GP in Coventry. Also, I'm a Cancer Research UK GP and Editor-in-Chief of GP Notebook. Today I'm going to talk to you about the Faecal immunochemical test, FIT test, in the detection of bowel cancer. The FIT test replaced the old FOB test because it is a test which is specific to human hemoglobin and not to other hemoglobins. It also is a test where it's quantitative, so that there's a specific level of hemoglobin in the fecal sample which defines whether it is positive or negative test. In bowel cancer screening, FIT is used at a level of 120 in England, i.e. 120 micrograms of hemoglobin per gram of fecal matter defines whether a test is positive or negative. In England, everybody aged from 60 to 74 every 2 years gets requested to have a FIT test as part of the bowel cancer screening programme. If the test is positive, they are then put forward for an endoscopy, a colonoscopy, in order to diagnose whether there is a adenoma or colorectal cancer. The level chosen in England is 120, which predicts about 2% of samples will be positive and need further investigation. In other countries there are different levels. For example, in Scotland they use a level of 80 which predicts approximately 3% of samples will be positive. If you use the sample down to a level of 20, then that would mean approximately 8% of samples taken would be positive and need further investigation. The lower the level of FIT in bowel screening, the more cancers will be diagnosed. However, the lower the level, the more unnecessary colonoscopies will be undertaken. The level set at 120 in England is something that may well be reduced in the future. So FIT also can be used as a test in primary care for symptomatic patients. The level suggested for this is a level of 10. And the patients where this would be appropriate would have a predicted risk of cancer of less than 3%. So various groups would have this test. For example, if somebody is iron deficient, anemic, but is aged under 60, they would have a FIT test. If they're anemic but not iron deficient and over 60, they would have a FIT test. If they're aged over 50 and have unexplained abdominal pain or weight loss, then they would be appropriate to have a FIT test. If the FIT test was positive in any of these circumstances, then this would define a 2-week wait referral. The third instance where a FIT is now used or can be used is within the 2-week wait pathway. This is not in reference to the various FIT pilots which have been undertaken previously, but NHS England have now stated that FIT can be used as a means of prioritising patients referred in the lower GI pathway. FIT can be requested in primary or secondary care. So the priority can be defined based on the value of the FIT test. So for patients who have a FIT test of greater than 100 on this pathway would be first order priority. If they have a FIT test between 10 and 100, they would be second order priority. And third order priority patients would be those patients who have a FIT test of less than 10. NHS England have stated that no patient should be negated from being on the 2-week wait pathway based on the FIT test result alone. The significance of FIT in this pathway is that if a patient has a very positive test, i.e. greater than 100 plus symptoms of colorectal cancer, the chance of having colorectal cancer is approximately 1 in 4. However, what about the negative FIT test? What about the tests which are under 10? Well, Professor Peter Johnson, the National Cancer Lead, stated that at a level of 10, approximately 10% of colorectal cancers will have a negative FIT. This emphasises the need for appropriate safety netting of this group of patients. So in conclusion, FIT is used in various circumstances. FIT is used in screening, it is used in symptomatic patients, and it is used in the 2-week wait pathway. The level of FIT for significance of a positive or negative result is different in these pathways, so it is in 120 for screening, and the suggested levels for symptomatic fit and in the 2-week wait pathway is a level of 10. If on the 2-week wait pathway a patient has a negative fit, this is not a rule-in, rule-out test for cancer, and so these patients have to be appropriately safety netted, and NHS England states that they should not be negated from the pathway based on a fit test alone. Thank you for listening to this video. I hope that you found it informative and you will tune in for further videos from GP Notebook TV.